Cyrex Laboratories is a laboratory that specializes in autoimmunity, specifically environmentally induced autoimmune disorders. We have next generation assessments for predictive antibodies for these autoimmune disorders. Autoantibodies can show up in the bloodstream up to 10 years before the onset of a clinical disease, which gives time for the practitioner to implement some simple lifestyle changes that can prevent the onset of the disease. And that way people can age in a healthy manner. There are 24 autoantibody markers that we're assessing, literally assessing from gut to brain. We assess bone, heart, thyroid, joint, neurological, of course, and other tissues throughout the body. And the 24 tissues that we assess are associated with more than 70 different autoimmune conditions. So you can take one test and screen for all of these well in advance of the onset of the disease, instead of doing these couple of antigens from that laboratory and then a couple months later we're going to test these antigens at that laboratory. We've combined them all into one place in a simple one blood draw and made it very easy. The precursor to developing an environmentally induced autoimmune disorder is increased intestinal permeability. And never before has there been an actual test, a laboratory assessment that a clinician could use to measure increased intestinal permeability. Until now, they have only been relying on a test called lactulose mannitol, which is designed as a nutrient absorption test, and for that purpose it serves very well. However, it is not a measurement of a leaky gut or increased intestinal permeability. Another thing that practitioners have been using is multiple food sensitivity, and basing the fact that if a patient has multiple food sensitivities, then that patient most likely has a leaky gut. There again, that is not a measurement of a leaky gut, because a patient can have multiple food sensitivities and still have a fully functioning intact barrier. So Cyrex developed a new test. It's our array number 2, and it is the increased intestinal permeability. We're measuring large molecules, we're measuring actual tissue damage. We are measuring antibodies to the tissue that makes up the intestinal barrier. That includes the occludin and the zonulin, which are tight junction proteins, and also actomyosin, which is part of the network protein cable structure that crosses epithelial cells. It is a quantitative assessment, so a practitioner can see not only where the breakage is happening, is it tight junctions or is it the cell structure itself, but also how bad the damage is. And then get a baseline of where the patient is, implement a treatment protocol from one of the fine vendors here that offers those, and then does a retest to see if that protocol is working on the patient. We also offer additional next generation assessments for gluten reactivity. The standard test fails, according to researchers, it fails 50% of celiac patients and an estimated 70% of non-celiac gluten sensitive patients. Our assessment relies on multiple proteins and peptides from wheat, whereas the traditional test measures only one protein from wheat. So we offer a complete picture of gluten reactivity as well as the autoimmunity it may cause. We do beyond transglutaminase number 2. We offer 3 different transglutaminases, so we can capture the patients who have gluten ataxia or dermatitis herpetiformis, not just celiac disease. So for Cyrex Laboratories, we do offer those next generation assessments that go beyond the traditional test. On our website, we have a wealth of information for clinicians after they set up an account with us that has multiple references and instructional videos on what all of this means.